Hello, expecting moms. Good news for you all. Finally, the COVID-19 vaccination has been rolled out for all expecting moms. And yes, you can go and take your jab. But there is a condition applied. The government says that a pregnant woman can take the vaccine only after she has been informed about the risk of COVID infection along with the risk and benefits of COVID vaccines available in the country. Based on these information, she can make her choice of taking the vaccination or not to take the vaccine. So, the ball is in your court. If you are an expecting mom, you have to make your own decision whether to go ahead with vaccination. We, the doctors, the nurses, the healthcare workers, can only guide you with the best available and possible information. I'm Dr. Rekha Thakur, an obstetrician and gynecologist with 19 years of experience practicing in Gurgaon. And I help expecting moms have a confident and amazing childbirth experience through education and empowerment. I receive many calls each day regarding COVID-19 vaccinations, and here I have tried my best to answer few most commonly asked questions regarding vaccination. Hope it helps you all in making your decision regarding vaccination. The first and the most commonly asked question is, ma'am, should I go for my vaccination? Yes, of course. Vaccination has been approved for all expecting moms worldwide. Though we do not have enough data regarding the effect of the vaccine on the baby, but right now we are on a mission to fight COVID virus and COVID infection. And we have enough and sufficient data which says that vaccination can save the mother and the baby by preventing the severity of COVID infection during pregnancy. So your query or your apprehension regarding the effect of vaccine on the baby, which I understand developmental or long-term effects, we are still unknown about it. We have no data regarding this. So we do not know about the long-term effects, but yes, the short-term benefits are multiple. And considering these short-term benefits of vaccine, we have no reason to refuse vaccination as of today. Now, these vaccines are a must for pregnant women who are at risk of exposure to COVID-19 virus, and they should consider taking the vaccination at the earliest, preferably even before the third wave sets in. Who are these high-risk pregnant women? So the high-risk pregnant women are healthcare workers or pregnant women who are doctors, nurses, paramedics, or front desk executives, or ASHA workers, or pregnant women who are working at primary health centers, or even women serving police, or pregnant women who are on the field or attending office every day serving people during this pandemic. So all the pregnant women who are out of their homes are at high risk of exposure to COVID virus. And not to forget, pregnant women who are living in densely populated areas where social distancing is a problem are at high risk of exposure, and all these pregnant women should get vaccinated at the earliest. The second question routinely asked is, what are the risks of COVID infection in pregnancy? In other words, what if I do not take the vaccine? Let me tell you, moms, more than half of the women who tested COVID positive in pregnancy have no symptoms at all. But in some pregnant women, COVID disease can transform into life-threatening illness, particularly if they have some underlying medical conditions like hypertension or gestational diabetes or many other conditions. Especially in the third trimester of pregnancy, COVID positive women are at increased risk of serious form of COVID illness, and they are managed in the ICUs. There are very high rate of ICU admissions in third trimester, and also very high chances of preterm births and infection being transferred to the baby during childbirth. A recent UK study found that pregnant women who tested positive for COVID-19 in England at the time of birth had high rate of preterm birth and stillbirth, and preterm birth which can even affect the baby's long-term health. And I'm very sure you moms would not like to take this risk. Go ahead for vaccination. The third question is, what are the benefits of taking vaccination? All the risks that I mentioned earlier are taken care of by vaccination. The benefits of vaccination noted till date are reduction in the severe form of COVID disease during pregnancy, reduction in the risk of stillbirth and premature birth, reduction in ICU admissions, and less chances of newborn baby being infected from the mother. And these are very good reasons why a mother should go ahead for vaccination. The fourth question is, what are the risks involved with COVID vaccines? Or in other words, what are the side effects of COVID vaccines? So, like all other medicines, even vaccines has mild side effects and they do not last long. Same with COVID vaccines. Very common side effects are pain or tenderness in the arm at the site of injection, or feeling tired, headache, body ache, malaise, chills, or flu-like symptoms with episodes of shivering or shaking for a day or two is very common. In case of high fever, one should take rest and also consult your doctor. The fever does not mean that you have COVID infection. COVID vaccination do not cause COVID infection. There have been reports of clotting problem associated with vaccine. So if you experience any unusual problem or any new sign post-vaccination, or any sign of clotting from around 4 days post-vaccination to 4 weeks, during this period, 4 days to 4 weeks, anytime, please reach out to your doctor immediately. So what are these signs that you should look for? The signs like shortness of breath, chest pain, leg swelling or abdominal pain, severe headache which is not relieved on taking painkillers or which gets worse on lying down, any skin rashes or blurring of vision, nausea, vomiting, any difficulty in speech or generalized weakness or any paralysis of limbs, drowsiness or really seizures, pinpricking sensation or rashes over the body, any of these signs, if you see them, please reach out to your doctor. But this list of signs should not stop you from taking vaccine. All these are same even for non-pregnant population. Now coming to the most difficult question, which vaccine to take? This is very difficult to answer because all the vaccines are good and they are approved by Government of India. The pregnant moms can take either Covaxin or Covishield. Both the vaccines have been approved for pregnant women. Now coming to the last question, what is the right time to take COVID vaccine during pregnancy? So moms, COVID vaccines are safe and it can be taken any time of pregnancy, be it first trimester, second trimester or third trimester. The early, the better, for two reasons. Number one, protection from ongoing COVID threat and fear of third wave coming in. Secondly, because you will have enough time to develop COVID antibodies before you deliver your baby, which will protect you and your baby during childbirth. Take the vaccination at the earliest. Beautiful mommies, thank you so much for watching my session, and if you have any questions regarding COVID vaccination and pregnancy, please write it down in the comment below and I shall answer them. You take care, stay safe, stay healthy, get yourself vaccinated at the earliest with a happy heart. Thank you and bye.